Good afternoon, everyone. Myself, Dr.Suprova Chakraborty, consultant pulmonologist working at Raj Hospital, Ranchi. Thank you for joining this session where we are going to discuss the common problems in winter. So, gone are those days when we used to think a lung problem means outside a lung clinic we will find a long queue of old generation people. Nowadays, we know everybody, in spite of their ages, we need to take care of our lung. And the winter season is coming, which is really worrisome for some people who are already suffering from various lung problems. So let us see how we can take some general precautions and preventions to keep our lung healthy. So in general, what aggravates breathing problem in winter? Winter, when the temperature dips, the dry and cold air especially aggravates the coughing tendency in people who are already suffering from bronchial asthma, COPD kind of diseases. And it also increases the flu tendency in some people. So it's always better to avoid when it is really cold outside. And especially when the smog forms outside, it is always better when the temperature is warm and little humid, that time to choose to go out. Let's see, the second question is what the general protection of the lung we can take in the winter. So here it comes all the general precautions like first of all avoid smoking. And if you're non-smoker, then also avoid those people who are smoking. Avoid any kind of smoke in your periphery, in your immediate environment, and also try to avoid our indoor pollutions, which comes through various ways. In some house around it, in Jharkhand especially, there are still uses of biomass fuel like wood, coal, these cow dung cakes. So kindly avoid that. And also people uses the mosquito repellents in a closed room or the incense sticks which are not of good quality and there is no proper ventilation in the room which increases the indoor pollution. And try to avoid to going in very dusty areas to avoid the external pollutions as well. And you have to be well hydrated and proper good hygiene and maintain proper food habits which will always help. So there is another question like which specific precautions we can take. See, we all learned from the COVID era specific precautions like always having a proper hand hygiene. Washing your hands have been protected for many lung diseases which can be bacterial or viral. So respiratory infections, either it's upper respiratory tract or it's lower respiratory tract infection like pneumonia, we can always keep ourselves one step ahead by washing our hands very frequently. The another question can be specific food habit to protect the lung. So in general, to maintain our immunity, we need to add a lot of food with rich in antioxidants, vitamins, minerals, and we all know green leafy vegetables are number one in that. We also have to add a lot of fruits in our diet and specific we can say that to maintain the immunity, sprouts and lot of nuts, various type of lentils should be added in our diet regularly to maintain the immunity. So another question comes here, which specific exercises can help us to improve our lung? Normal walking with a good pace. You can say in a speed where you are sweating, let's say 100 steps per minute. That kind of walking 20 minutes or half an hour, at least 5 days a week. That kind of exercise helps a lot for not only the lungs but all the vital organs to maintain our overall health. And along with that, breathing exercises, especially the right breathing techniques, always helps. So, free hand exercise, yoga, pranayam, breathing exercises, walking, jogging, light running always helps. So here comes a specific question like which right breathing technique should be adopted to proper the maintain lung posture and lung health. We we forget that only 4 times maybe we take food, maybe 10 times we take water, but 10,000 times or more we are breathing air. So, if we don't know how to breathe properly, that is a root cause of many problems. So, we need to see like we are breathing properly or not. How many times we are breathing per minute, and with the full capacity of lung we are breathing or not. So, here in a few minutes of a day you can spend to breathing properly. Just take a deep breath, inhale properly from nose, closing your mouth. Hold for few seconds and try to inhale as long as you can feel the pressure in your abdomen. So this is a deep breathing technique which helps everyone. And for person who are already suffering lung diseases like COPD, there are some breathing techniques like diaphragmatic breathing, half breathing, deep breathing exercises. You can put hands in your abdomen. Completely inhale with your nose and try to breathe from your mouth, pursing your lips. Exhale as long as possible. So there are some specific techniques which are disease specific. So you should contact your doctors to know these techniques more properly and to apply in your daily life to increase your lung function, to increase your quality of life. And for general population, it always helps to have a right breathing technique. We can always spend few minutes of a day to breathe properly so that we can keep our lungs healthy. Let's come to the next question. How much importance is vaccination? Vaccination is always important on schedule as for children as well as for adults and the elderly adults. So nowadays, after this COVID era, we should be more cautious about our lung infections, and yearly an influenza vaccine can prevent the severity of the viral pneumonias in many elderly people. So, not only for children and not only for the adolescents or the aged, elderly, sick people, it's also good for healthy adults to take the influenza shot. Normally, this should be taken around month of August, September when the new strain comes for that year, and it protects you two seasons, mainly the autumn and the spring. So we have to see the vaccination schedule is proper or not. You should contact your doctor to know if you have a specific contraindication for taking any specific vaccine or not. Let's come to the late question. The next question is how people with chronic lung disease will protect their lung. See, I think I have already covered that section. People with chronic lung disease like COPD, bronchial asthma, ILD, they have more tendency to catch the flu, pneumonia, lung infections. So they have to be more cautious. First of all, to treat the baseline disease, whatever it may be, to take the proper dosage of medication and stick to that. The adherence is the big issue. With the right, proper food habit and the medicine, regular medicine, first of all, to stick to that, and afterwards to take some general precautions like not to go outside when it is too cold or it is too smoggy or it is too smoky outside, too dusty environment to avoid. You want to go for a morning walk, but you have bronchial asthma, you should avoid the early morning cold air. Go outside when it's a little bit warm or little bit humid. You can wear a mask, or what you can do, use a scarf to cover your nose, mouth and ear so that it prevents the cold water to enter, and it should not give a trigger to increase your baseline disease like bronchial asthma or COPD. So this is how people with specific lung disease can somehow protect their triggering factors, or they can protect themselves from flu. So the next question is how people with COVID will take precautions. See, People with COVID are not a specific population. We have seen many healthy people without any comorbidities have suffered from severe COVID also, and some of them still suffering from the kind of weakness, lethargy, which belong to the long COVID symptoms. So the general precautions should be taken. They should maintain all the general routines to prevent diseases like proper food habit, proper hand hygiene, to maintain their own immunity. They should do the right exercises, not to overdo it, and not to do any kind of panic that they are more prone for any other kind of diseases. It's not like that. So their precautions belong to the same category of the any adult or elderly adults in general. They should do the proper right breathing exercises, have food on time, and take any baseline medications they are continuing to take for any other diseases. So here comes the last question. How long does it take to clear tar after you quit smoking? So once you start smoking, it's not only tar, there are 7,000 kind of toxic chemicals as well as carbon monoxide which enters in your blood as well as in your lung. So as soon as someone quits smoking, the lung starts healing within a week. So how long it will take, it depends that person, how long he has taken cigarettes. Naturally, the lung starts cleaning like 1 to 3 weeks, but it depends it the capacity has overwhelmed or not. We see the improvement of lung function within starting from 3 months. Within 1 year of quitting smoking, it has been seen that heart attack risk have reduced to 50%. And after quitting, let's say 2 years to 5 years, and the lung cancer risk, the oral cancer risk also reduced by 50%. So as the time goes by, after you quit smoking, the body generally heals and the lung also starts healing, but it becomes completely reversible or not. That is very difficult to say because it depends how many cigarettes for how many years the person has taken. So, in general, what is the conclusion? We should avoid smoking at any cost. Our environment is already very polluted, and this air pollution has already a lot of effect on our all the vital organs as well as lung. So, we should be very careful what we are doing, what we are taking, and we should be careful to take minimal precautions which can help our lung in the long way. Thank you so much.